COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the first time. It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can land in the mouths or noses of people who are nearby. These droplets are too heavy to travel far in the air. They only travel approximately 1 meter and quickly settle on surfaces. This is the reason person-to-person spread is happening mainly between close contacts. The exact time that the virus can survive on surfaces is not yet known. So it is wise to clean surfaces regularly, particularly in the vicinity of people infected with COVID-19. Hands touch many surfaces, which can be contaminated with the virus. You should therefore avoid touching your eyes, nose, or mouth, since contaminated hands can transfer the virus from the surface to yourself. When coughing or sneezing, cover your mouth and nose with the bend of your elbow or use a disposable tissue. If a tissue is used, discard it immediately into a closed bin. The most effective way to prevent the spread of the new coronavirus is to clean your hands frequently with an alcohol-based hand rub or soap and water. This will eliminate the virus if it is on your hands. Stay healthy and prevent the spread of COVID-19.
Hello, I'm Dr. Takeshi Kasai, the Regional Director of the WHO Western Pacific Regions. A soap and then the water is the best tool to really fight the COVID-19. I wanted to show how I wash my hands. Washing hands regularly well will protect yourself, but also your family, your colleagues, your friends, and Hello, I'm Dr. Takeshi Kasai, the Regional Director of the World Health Organization for the Western Pacific. Today, I would like to talk about the new coronavirus diseases, COVID-19. In the past 2 months, we've been working so hard to respond to this COVID-19. I know people are worried. In fact, even in my house, we frequently talk about the COVID-19. And my daughter talked to me that she saw some TV saying this as a deadly virus. But she also heard from her friends that this is not a big deal. Actually, both are not quite right. The data today shows that majority of the people are experiencing mild symptoms, or people may not even notice that they're getting infected. But some get severe diseases, and unfortunately, a small proportion of people suddenly die. Those who passed away, the majority of them are aged above 60 or having an underlying condition such as a hypertension, diabetes, or heart diseases. And what is very important is that we work together to protect those vulnerable. Here's what we can do. A very simple practice. One, you wash your hand regularly and well. You should also cover your mouth when you're coughing. We call it coughing etiquette. And when you go out, keep distance from somebody who is coughing. And in case, if you have symptoms, please stay in your home and follow the advice from a local authority. There are many people around the world working so hard to push this virus back. But it's unlikely this virus disappear next week or even within the months. But what is important is that this simple practice to make your daily habit, you can protect not just yourself, but your family, your friends, your community, and the vulnerable. So please practice this. Thank you very much.
Whenever there's an outbreak of a disease, and especially in the current outbreak of this new coronavirus, misinformation and rumour can spread much more quickly than the virus itself, and it can be just as dangerous. That's because when people have the wrong information, they can make decisions which are actually harmful to themselves and to others. For example, people are sharing information online about treatments that are not proven. We're also seeing fear based on misinformation, driving stigma and discrimination towards Chinese people. At WHO, we're very focused, working with our partners and, of course, our member states, on getting the right information out to the people who need it. It's, in fact, one of the really important things that we do to support countries in a disease outbreak. In all of our response teams on the ground, we have risk communications experts embedded as part of those teams, so we can support countries to be getting the right information out to their populations too. We know that the best way that you can protect yourself and your family is to wash your hands all the time. If you're coughing or sneezing, cover your mouth with your elbow. If you're around somebody who's sick, stay away from them. Try to stay at least 1 meter away. And if you're sick yourself, stay home so you don't risk infecting others. If you're really sick, if you're having trouble breathing, if you have a fever, please seek medical advice, but call ahead so that the health clinic or health facility knows that you're coming. We at WHO will continue to stay focused on getting out this kind of information to the public, but we need your help. Please don't share misinformation or the wrong facts online with your friends and families, but please do share information from us at WHO as well as advice from your local health authorities. Thank you very much.
Hi, my name is Cassie, and I'm 16 years old. I've seen on social media that the new coronavirus outbreak has provoked a lot of social stigma and discrimination. This is harmful to not only those who suffer from it, but for everyone. Stigma can isolate people. It can drive people to hide their illness to avoid discrimination, and can even prevent them from seeking medical care. So it is very important to avoid stigmatizing people. And we can all do this. How? Basically, by understanding that words matter. Do talk about the new coronavirus, but don't attach locations or ethnicity to the disease. Do talk about people who have or may have COVID-19, people who died after contracting COVID-19, but don't refer to the people with the disease as COVID-19 cases or victims. Do talk about people acquiring or contracting COVID-19, but don't talk about people transmitting COVID-19, infecting others, or spreading the virus, as it implies intentional transmission and assigns blame. Do speak and share accurate information about risk from COVID-19, but don't repeat or share rumors that are not confirmed or language that spreads fear. Do talk positively and emphasize the effectiveness of preventative measures, such as hand washing, but don't emphasize or dwell on the negative or threatening messages. Most importantly, do good. Use your social media account to spread facts and solidarity. This will help us to prevent the spread of COVID-19.
In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow, avoiding close contact with those who are unwell, the appropriate use of masks and personal protective equipment, especially in a healthcare setting, washing hands regularly with soap and water or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell, but if you have a fever, cough, and difficulty breathing, seek medical care early and share your previous travel history with your healthcare provider. That's a quick look at this emerging infectious disease. Given that this outbreak is evolving rapidly, what's known about this virus can change. Please check the websites below for the most up-to-date information.
xin được gửi lời cảm ơn sâu sắc nhất tới các đồng nghiệp, tới các cán bộ y tế dự phòng, những y bác sĩ đã không quản ngày đêm hy sinh và chịu đựng những rủi ro trong công tác chăm sóc và điều trị bệnh nhân Covid-19.
Tất cả các cấp chính quyền, lực lượng chức năng đã làm việc liên tục không mệt mỏi để ngăn chặn sự lây lan của virus.
Xin gửi lời cảm ơn tới tất cả những người bạn của chúng ta trong công việc truyền thông đã đưa tin về Covid-19 và góp phần truyền đi những thông tin chính xác kịp thời tới cộng đồng. Xin được gửi lời cảm ơn tới các anh chị bảo vệ đã kiên nhẫn trước những phản ứng không hợp tác của những người không muốn sát khuẩn tay hoặc không muốn kiểm tra thân nhiệt trước khi vào các tòa nhà.
Tất cả các nhân viên vệ sinh đã ngày đêm làm việc để đảm bảo các bệnh viện, nơi làm việc, khu vui chơi và chỗ ở của chúng ta luôn được sạch sẽ.
Xin được gửi lời cảm ơn tới tất cả những người đã và đang làm việc ở tuyến đầu trong cuộc chiến chống Covid-19. Xin cảm ơn.
Namaste.
Thank you very much.
Merci beaucoup. Tatenda siabonga. Xin cảm ơn.
Khắp trái lên lại.
Tote. Kermila Margaret. Maraming salamat po. Arigatou gozaimashita.
감사합니다.
Xin cảm ơn.
For the first time ever, we, the entire world, are all playing on the same team. Our opponent is a disease. We need determination, discipline, and teamwork to beat the coronavirus. The world of football is united, and together, we will win.
There are 5 key steps to tackling the coronavirus: hands, elbow, face, distance, and feel.
Comece pelas mãos. Por favor, lave as mãos com frequência usando sabão ou gel desinfetante.
With your elbows bent, please cover your nose and mouth if you sneeze or cough. If using tissues, dispose of them immediately.
Respecto a la cara, evita tocarte tus ojos, nariz y boca, así puedes evitar que el virus entre en tu cuerpo.
保持距离，对于人与人的交往而言，要保持一定的距离。对于有咳嗽等症状的人来说，更要保持在1.5米以上的距离。要学会避让、躲开。
Si vous vous sentez mal, restez chez vous. Et suivez scrupuleusement les consignes des autorités sanitaires.
Logistics, we work under the concept that the right item be sent to the right people in the right place at the right time. In any emergency, it's critical that we get the right supplies to protect our healthcare workers. Healthcare workers are essentially the main response pillars that we have. Without the healthcare workers, we won't be able to stop this transmission in time. 14 of us. The problem that we're currently facing now is a very stressed market with very limited supplies available to us. And when people use them irrationally, it makes a strain on the healthcare system and difficult for us to ensure the safety of the healthcare workers working in wards. We want to try to limit the overuse of protective equipment. That includes aprons, gowns, gloves, and masks, and to make sure that it's used rationally and for the right cause. It's important for us to make sure that we can stop the transmission of COVID-19. The WHO at the country, regional, and headquarter level are making sure that all efforts go in to identify the right supplies get sent to the right place at the right time in order to protect the healthcare workers who are working on the COVID-19 response.